All right, I want to talk about one of the most interesting research studies that really simplifies manual therapy. And I have a few excited assistants that are going to help demonstrate this. It's done by Kim Ross, Dave Bereznik, and Stu McGill almost 14 years ago, but hardly anyone knows about it. And it's about the skin fascia frictionless interface. And what it means is that most of the forces that go into the body when you're trying to manipulate a joint or move a joint or change some sort of soft tissue aren't really going into the joint surface the way you think that they are. You know, what it demonstrates is that the interface between the skin and the bone is frictionless. So the only force that goes in is that which is perpendicular to the bone. So Violet, come here, buddy, and I'll show everyone what I'm talking about. So if everyone just takes their face, this face here, and you just start gliding the skin around, see how that just slides and glides? I can move her skin, but I can't grab the bone. I didn't do that to your tongue, did I? I can't grab the bone underneath. You can't grab this bone and slide it up. It doesn't matter if you press hard and say, oh, I'm taking up the skin force, and you can't slide that up. I can't slide this around. I know the skin has to like grab on somewhere, otherwise I could just like turn her face, like her whole skin to the back of her head, and that'd be super creepy. Same thing like the ribs. If you think like a rib is slid out to the side, you can't grab it and slide it in. Of course they can see you. We'll use you next. You can't like grab that rib and slide it in this way, but that's okay. You could go on this side and push in, you know, or the biceps. You can't grab the biceps here, these massive big pipes, and you can't like pull the biceps or you're pulling and friction it. No, it's just the skin. It slides over that. And this is true throughout the whole body. In the back,
you can feel it.
It's the same thing. You know, you can't take a joint here and say, oh, the rib, it's rotated posteriorly. So I'm going to grab it and I'm going to traction that rib and push it up. All you can do is push down into the rib. You can push the rib forward. You can push it this way. You can push it that way. But you can't rotate it. You can't slide it down. You can't slide it out to the side. Same thing on the scap. You know, you can slide this all you want. You're just sliding over the muscle. You can't move the scap here unless you get on the inside of the scap and slide it up. Whoa, I slipped under. Dysfunctional scap. And so thanks, sweetie. That's, again, a paper by Kim Ross, Dave Bereznik, Stu McGill, a long time ago. It says most of the stuff that we're doing in manual therapy is not what we think we're doing. You know, we're doing something else. It might explain another mechanism, but we have to simplify. That's the big thing. All right, thanks, girls. Same thing, Betty?
I didn't even get it.
Come over here. I'll show them you. Another big one is the clavicle. Give me your clavicle. Same thing. You can't rotate the clavicle backwards. Look at that. See? You're just sliding it around. Just moves everywhere. That's a good thing. That's so that we can move. So remember that study. Adios.